I was born and raised in Ketchikan, Alaska, throughout the early 70s. My father was a veterinarian. The clinic was attached to our house, and I helped out lots in terms of assisting in the operating room and so forth. One of my big decisions was, do I go into medicine or do I go into veterinary medicine? And then once I decided to go into medicine for people, one of my big decisions was, do I go into surgery or do I go into family practice? I was a commercial fisherman through my college summers and the first few summers of medical school. I ended up getting that job because I was a soccer coach when I was a junior and senior year in high school, and a couple of the kids that I coached, their parents were owners of this commercial fishing boat. And I was looking for a way to pay for school, and I said, geez, it can't be much better than that. When I interviewed here, the resident that took us on the tour took us to the top floor of Maine Medical Center, and she said, you know, you work really long hours here, you get a great education and great training here, but time is short. And she said, there's the ocean and there are the mountains. I said, sign me up. I met and married a woman from Westbrook, and Carolyn is now the chief of anesthesia here. So she's an anesthesiologist. So when we were looking for jobs, this was a place that accommodated both a surgical position and an anesthesia position as well. Interestingly, my first job here in town was right across the hall with one of the other surgeons, and after a couple of years in practice, I went out on my own. I managed my own practice for 10 years, and then I came back to St. Joe's, and I've loved it here the whole time. This hospital is amazing. General surgery, it's hard to say it's everything else, but it's kind of everything else. So when you take out the orthopedics, you take out chest surgery, you know, general surgery encompasses much of the other procedures that you think about. So general surgeons deal with, you know, lots and lots of abdominal surgery. They deal with lots of skin and subcutaneous surgery. They deal with endocrine problems, breast problems. So the abdominal types of things, you know, hernias and gallbladders are very common. Colon surgery is a very common part of what we do. With laparoscopic surgery, hiatal hernias, adrenal gland surgery, liver surgery, pancreas surgery. You know, there's a very, very broad breadth of things. Being in a smaller hospital, we don't have a bunch of residents everywhere, and so it takes away some of that educational feel of a place. But at the same time, when somebody comes to see me, they get me. They don't get me and 3 residents that I'm teaching, and who may be learning from them. And so, you know, when I've done a procedure, it was done by me, and the experience that comes from that is something that I gain. And so I think the providers here learn nuances of things that you might not as much in a larger teaching hospital. You know, there's a great benefit to doing a volume of surgery. And so when you've done the same procedure 500 or 1,000 times, I think you get to be quite good at it. Same thing in cardiology, same thing in rheumatology. You know, there's the providers that are here do a phenomenal job.